Good morning, everyone, and happy Friday. It's time for the Henry County Health Center FYI. This morning, we're talking with Dr. Joel Ryon, Medical Director of the Henry County Health Center Clinics, and we're going to be talking about COVID-19 and the vaccine and all of that good stuff. So stay tuned to get the latest information. And firstly, good morning, Dr. Ryon.
Good morning. Thanks for having me.
Yeah, we're so glad to have you on, and certainly to talk about COVID-19. Things have been crazy this last year and a half. It was getting better. Now maybe it's getting a little bit bad again. So as a family practice physician and a medical director of the Henry County Health Center Clinics, we really appreciate you to, come on and talk about the current status of COVID-19 and the vaccine. We've recently been hearing about the reports of the Delta variant and the rising numbers of COVID. Can you maybe explain what is meant by a variant and how the variant is impacting people differently than maybe what we thought COVID was doing before the variant?
Yeah, that's a great place to start. COVID-19 is a virus, and one of the hallmarks of viruses is that they change, they mutate. That's why we have to get a new influenza vaccine every year. Cold viruses are constantly changing. And COVID is a coronavirus, which, put it out there, it is a cold virus. Coronaviruses are cold viruses. We haven't had vaccines for these in the past. So when it first came out, there was a specific type, but as it changes how the structure of the virus works. So it infects the cells in a little different way. It causes slightly different symptoms and also can be more contagious. And unfortunately, that's what's happened now with the Delta variant. At this time, almost all the COVID circulating in the United States is the Delta variant. And what we've found is that it is more contagious. One person who has the Delta variant now, it's estimated that they can infect up to 5 other people, whereas the original COVID virus could only infect, about 2 other people. So it's spread much more easily and is also causing more severe symptoms. And we're seeing that in the younger population especially.
Yeah, so with this information, maybe there's people listening that have kind of been hesitant to get the vaccine. I mean, are the 3 vaccines that are offered right now and currently available helping to protect people against the Delta variant? Would this be a good time for people to maybe think about getting the vaccine?
Yes, absolutely. They've been doing studies on this all along as these new variants have come out, and they've found that the vaccines that we have do still work against the Delta variant. The part of the virus that's changed has not been the part that the vaccine was built to recognize, and so the vaccines are still very effective, and absolutely recommend that this is a good time to get the vaccine if you haven't gotten it already.
So with that, we get the vaccine, we think that we're protected, but now we're hearing about these breakthrough cases being reported of people who were vaccinated and still contracted the virus. Can you talk about that and maybe explain how those people are reacting to the virus?
Yeah, that can be a little bit tricky to understand. So vaccines are never 100%. None of the vaccines that we have had in the past are 100%. And these vaccines, although they're very good, over 90% effective, we're finding that there are some cases that still can develop with COVID, even if you've been vaccinated. And part of that is related to the individual, how much of an immune response the individual had to the vaccine, just general health characteristics of the person. Do they have underlying medical problems? Are they immunosuppressed in some way? How much of the COVID were they exposed to at the time of the exposure? So a lot of different factors in that. But one of the good things is that people who have been vaccinated are almost never hospitalized. Less than 0.1% of the people now that are hospitalized with COVID are vaccinated. So pretty much everybody that we're seeing in the hospital and almost everybody with severe disease is unvaccinated. So having the vaccine will definitely reduce the severity of your illness. It'll reduce the duration of your illness. And it also reduces how contagious you are to others. So they have found that people that are vaccinated that still have COVID infections don't shed as much of the virus as unvaccinated people. So it helps control the spread in that way if you're vaccinated.
Yeah, so that I was just going to ask. So you're saying that if somebody is vaccinated and they get the virus, they don't spread it as much?
That's correct, yeah. The virus doesn't seem to get to as high a level in that person, and so they're not spreading that. It's primarily spread through aerosolization, and so they're not spreading as much virus, and they're also not spreading it for as long of a time period. So it's fewer days that person is actually contagious as well. The vaccines themselves, getting a vaccine does not make you have the illness or make you contagious to others. The vaccines don't contain the full COVID virus. They just contain a piece. So it is impossible to catch COVID from the vaccine.
Okay, I think that's a great explanation and something to kind of clarify because that can get confusing for people.
Yeah.
So thanks for talking about that. Let's talk about the vaccine. Is it still available, and where can people go to receive that?
Yeah, so the vaccine, we are very fortunate here in Iowa and in the U.S. in general that we have an abundance of vaccine, to be honest with you, compared to other places in the world. There are the three types of vaccines that you mentioned before. So they're not all available every place. Public Health, the last time I checked, they have the Johnson & Johnson vaccine, which is a one-shot, and then the Moderna vaccine, which is a two-shot series. Hy-Vee also has vaccines. I believe they have the Pfizer vaccine, and the important difference there is that the Pfizer vaccine is actually approved down to age 12. So if you have a middle schooler or a high schooler, they can go to Hy-Vee as long as they're 12 years of age or older and get started on that vaccine series. It is a two-shot vaccine as well. First dose, and then the second dose is 3 weeks later for that one. Walmart, I believe, also has vaccines available. I think they're either Johnson & Johnson or Moderna. I'm not 100% sure on that one, but I would definitely check with those three places.
We're starting to talk about these booster shots. Do you want to talk a little bit about that and maybe what people should do?
Right. So that is something that we're still getting information about. It's still developing. They're looking at how long these vaccines last or how effective they are over time. I mean, honestly, we really only have data for about 8 months now. The first vaccines became available late December, January. And so, we don't know how long they're going to last. So the drug companies, the government, they've been monitoring, these breakthrough infections, other types of infections. How is the immunity holding up over time? And booster shots are one potential way that you can improve the duration. So just recently, the CDC has come out and recommended booster shots for anybody that's immunosuppressed, which is not a term that most people probably use in their everyday, conversation, but they're referring to somebody who's on specific medications, might have received an organ transplant or chemotherapy for a cancer or certain types of arthritis. There's medicines that suppress our immune system to try to treat those specific conditions. Well, unfortunately, what they found is that also affects how our immune system responds to the vaccine. And so they maybe haven't had as good or as long of a lasting response to the vaccine. And that's where we're beginning to use boosters in those situations. And that is specifically for Moderna and Pfizer vaccines, I believe. The Johnson & Johnson vaccine, I don't think they have data on booster shots for that one yet. Will booster shots be necessary for everybody else down the road? I anticipate that will become the case, that the rollout for that sort of vaccination process will be similar to when we first started receiving the vaccines last winter. It'll be the higher risk populations, probably nursing home populations, healthcare providers, those people first, and then as we go along, transition to, potentially the general population. So when they do make that recommendation, we'll have to see how that comes out. It'll probably be at an interval after you received your first COVID vaccination series. So it might be, if, for example, you had the Moderna vaccine like I did, it might be that it would be recommended to have a booster shot, 9 months after that second shot in your original series. So it wouldn't be that everybody would need a booster shot right away. If you just had your original series in May, you might not need it until later on in next winter.
Yeah, I think that's good information to share, and certainly changing all the time. But I think some people were confused. If you're, like me, if you're relatively healthy, you may not need that booster. So don't be, worried about that just yet. Just hang on for more information, kind of like we've been doing this whole time, right?
Yes, exactly. It's always changing. And this is still such a new thing in that, how we think about medical illness and disease. Really, a year and a half is not a long time. So things are still changing rapidly.
So I heard you mention that you got the Moderna vaccine. So I'm going to ask you maybe personally, what were your main reasons for getting the vaccine?
Sure, yeah. I did receive the Moderna vaccine pretty much as soon as we offered it here at the hospital, and that was the very end of December and January. And, I did it because of, I wasn't forced to do it, first of all. I've had that question. Nobody here at the hospital back at that time was forced to get that vaccine. We all volunteered to get it as soon as we could. And, for personal reasons, I don't like wearing masks. I don't think any of us do. And it seemed to me that this was going to be, the quickest route to get away from that. We still wear masks every day, all day, pretty much here at the hospital. But also, I felt safer for myself meeting with my patients, but also I knew that I was protecting my patients as well. If I did, develop a low level of an infection or somehow was contagious and potentially spreading the illness. So it was a safety thing for myself, but also to keep my patients safe as well. So I think that's an important consideration that I would like people to think about a little bit. I mean, I can come on the radio and recite all the statistics that you can see on any of the news stations or hear in a ton of interviews. But, I don't know that the statistics are what's, it's hard to put that in context for a lot of us. And so I think, if we think about our families and the people, our neighbors, the people in our community and, how this has affected them. And we are seeing additional cases now. It started about 2 to 3 weeks ago. We started seeing more positive cases here in the clinic. We're seeing more positive cases in the hospital. We're seeing very sick people in the hospital that we're having to try and transfer to other facilities who sometimes we have difficulty getting those transfers accomplished because hospitals in other cities with the ICUs and the more advanced care, they can be full. And so, trying to protect our community, getting vaccinated can be a way to do that. So, think about your family and your friends and your neighbors, and as well as trying to protect yourself, and consider it if you haven't gotten it yet.
It sounds like you're giving a lot of reasons why people should consider to get the vaccine, but let's say they're listening and they're still hesitant. What would you recommend they do? Yeah,
well, it is a little scary, to be honest with you, because the vaccine, we mentioned it earlier, hasn't been out for that long. So, what are the long-term side effects of this? Can there be complications in the future, that type of thing? Try to find a resource that you trust, I guess, and that has, accurate factual information. So not an opinion page necessarily on the internet, but a website that'll give you facts, and also talk to other people that have gotten the vaccine. What was their experience with it? How have they been feeling since they had it? The CDC websites, Iowa Department of Public Health websites are great for information that you can read, but talk to someone that and again, ask what their experiences were, why they got it. And are there side effects? Yes, there are side effects from receiving the vaccine. So most people feel not the greatest, especially after that second dose. You can have low-grade fevers, body aches, sweats, nausea. It typically only lasts 24 to 36 hours.
Yeah, try that for 3 weeks when you get COVID, right?
Yeah, COVID, you can feel that way for a long time, and there's no guarantees that you'll have just a mild case of it. It can last for a good 2 to 3 weeks. So.
Is there any other things as to why it's so important for the unvaccinated to get vaccinated maybe right now, today, if they're listening?
Yeah, well, the other thing, school's starting, so that's going to be a big thing. We want all the kids to go back to school and have as much of a normal type of school year as possible. Our extracurricular events are a big part of our community here in the fall, the football games, the band, marching band competitions. And so we really, we want to provide those opportunities for our kids. They've missed out on the last couple of years. And, getting that back, we don't want that to drag out. So I think that's a good reason. But another reason is, circling back around to the variants, the less that virus that is circulating in the community, the lower chance of these variants developing. So if we can just reduce the level as much as possible, that will help to slow the development of the variants. And hopefully we don't end up with variants that are actually more severe and cause more illness than we currently have.
So along with getting vaccinated, what other mitigation efforts, if any, are still important at this point in our COVID-19 pandemic journey? Right.
So masks still work. Okay. That's why we wear them here at the hospital with every patient interaction, and even when we interact with our coworkers here. So your N95 masks are the best. They're difficult to wear for a very long time. We don't wear them. We wear the surgical masks, which are very good. Your cloth masks that you can get at the store or make yourself are effective as well. So any of those are really good options, especially if you're out, if you're at a place where you're around a large number of people. That's a good way to help control the spread and protect yourself. You can try to limit your involvement in any activities that have big groups. Of course, you're at a higher risk the more people you're around. So keep that in mind as you go out to different activities this fall.
All right, Dr. Ryon, I think those are great points and certainly appreciate your insight and information sharing on COVID-19 and the vaccine, Dr. Ryon. Is there anything else this morning that you wanted to let people know about that we did not hit on?
Like you mentioned, though, if people still have questions, if they have concerns, you can go to those websites, but also call your healthcare provider, talk to someone that you've had a relationship with in the medical community. Most of our healthcare providers here in town have been here for many years. Lots of families have grown up with the same provider. So that should be someone hopefully that you trust and would value their opinion. So get in touch with that person as well.
Well, we've been talking with Dr. Joel Ryon, the medical director for the Henry County Health Center clinics in Mount Pleasant and Henry County. Thanks so much for coming on KILJ this morning.
Okay, thank you for having me.